Well, hello and welcome to the latest episode of the Ultimate Wellness Group Transformation Tuesday. Got a special show for you today, the last show of Ramadan 2021. I'm going to open up properly, and then got a couple guests coming in. But I also wanted to give you all a little new information on this Black-owned streaming site. So I'm going to give you a little information. I am actually streaming from there as we speak. And so I'll give you the information, and maybe you all can check it out while we're doing the show tonight so that you can see where I am trying to go. I'm trying to go to that site. It's owned by us, and I want to support it. I'm not going to talk pro-Black and then not put my money, my time, and my effort and my gifts through somebody else's reality, right? So let's start properly. In the name of Allah, the Beneficent, the Merciful, I bear witness there is no God but Allah, and I bear witness that Muhammad is his messenger. I further bear witness that that God that I'm speaking of came in the person of Master Father Muhammad, July 4th, 1930, made himself known. And then in 1931, he met with the man that this show is based on. I'm speaking of the Honorable Elijah Muhammad. He was with Master Father Muhammad for 3 years and 4 months, learning from the master of the universe. And that's why this show is based in that book, because that book, to me, is superior than all the information that I learned when I went through all those years of school. It taught me what I can keep and taught me what I should or need to throw away. And of course, neither of them left us alone. They left us with a wonderful counselor, a guide. In this day and time, somebody is extremely important at a time now where the line is being drawn in the sand, or has been for a long time, but is becoming more and more obvious. We'll get into that a little bit, but I'm speaking of the Honorable Minister Louis Farrakhan, and today is his birth anniversary. He was born May 11th, 1933. And so such a wonderful man. I just want to give him my greeting of Assalamu alaikum, and I pray that he had a wonderful day and has many, many, many more. And I also greet all of you with the words of peace of Assalamu alaikum. Anybody who's hearing that for the first time, that's just my way of opening up, giving credit to those that are more superior than I, that helped put me in this position. And I'm also asking that God remove my impediments, my ego, my arrogance, so that I may be a vessel for you. So today's show is going to be dedicated to getting some excellent information about some of our frontline people on this vaccine and what we're dealing with the vaccine. So let me go ahead and pull in my first guest. You've seen her on the show a couple of times before. There's her backdrop. She'll be there soon. There she is. Oh, you still coming in your audio. But here's a hard-working sister. I've told you all about her. You've seen her on the show before. Now you're on mute, my sister.
Am I on mute now?
There you go. Assalamu alaikum.
Walaikum salam.
How are you?
Doing well, beloved.
Praise.
Are you on now?
Yes, ma'am. We on. We live and ready to go.
Oh, I did not know.
That's okay. You are ready, right?
Yes, sir.
Praise be to Allah. So go ahead. I'm going to let you introduce yourself quickly, and then we're going to get into what we came to talk about this evening.
Okay. Well, in the name of Allah, the Beneficent, the Most Merciful, all praises due to Allah, the Lord of the world, the Beneficent, the Most Merciful. I bear witness that there is no God but Allah, and I bear witness that Muhammad is his messenger. Ramadan Mubarak, dear beloved.
Ramadan Kareem. My sister, has it been a wonderful Ramadan for you?
I'm striving and struggling. I'm just going to tell you the
Me
truth.
too. Me too.
But I'm Tamara Muhammad. I am a travel critical care nurse. I have been traveling straight for the last 7 years. Hopefully, some of you who watch the show have seen me in your cities. That means LA, Baltimore, DC, Memphis, you name it. I've seen you, I've been there. I actually work at the bedside with COVID, so I'm hoping to help with our beloved Brother Keeley here to clear up some of the stuff that we see in the media to actually what we see at the bedside. And so you are looking at a sister who, praise be to Allah, alhamdulillah, that is healthy and well, who actually work with COVID patients at the bedside. And hopefully what I have to share with you will be informative and helpful. And I'm hoping that it will de-escalate some of the fear so that we can make some informed decisions.
Absolutely. And thank you, sister. For those of you who are tuning in, I consider myself having a pretty busy schedule, but I'm extremely thankful because I know your schedule is hectic. Spending the time in the hospital, the high stress and the high rate of things that happen there. And she's working not in the easiest part of the hospital, but the most difficult part of the hospital, in my experience. The ICU and the emergency room are the most difficult aspects of the hospital. I'm not trying to say anything else is easy, but it's definitely the most difficult. Those two areas in my career and my experience were very, very difficult. And so I thank you for taking some of your time. I know it's not always easy to find time. That's probably why she's not on here more, because she is so busy. But I wanted to just give you that shout out, my sister, because I know you are very humble, and the way that you just described yourself to our audience is very humble. But you, brothers and sisters, you can't be a traveling nurse like she is, going around all over the country and be shabby. She's got to know what she's doing. Okay. And so I'm saying that because I want you all to know that you're getting quality information here today. You're not getting information for somebody who can't make it in this industry. You will be talking to people today that have the ability and have been the best in this industry. And so we didn't come here to play with you. I don't come here to play with you all. I don't bring people on my show that I don't highly respect. And this sister is somebody that I've been knowing for a while, probably right around 10 years now, probably. I would say somewhere around there. Yeah. And I respect her craft. I respect her knowledge, and I respect the way she stands for herself and her people. She stays in control. And that's what this show is about empowering people so that you can stay in control. And so I'm going to give it to you, my sister. Let's just get right into it, right? We are at a time where you and I can say we believe in a man named Minister Louis Farrakhan, the Honorable Minister Louis Farrakhan. That's what we believe. And I'm not saying that anybody listening has to believe in what I believe in, but I'm trying to set the stage for why we're going to speak to you the way we're speaking to you. We believe that the Honorable Minister Louis Farrakhan is the spokesman of God on the planet Earth today. And so when he said the words behind me, don't let them vaccinate you, that is based on a lot of wisdom. It's based on a lot of information. We're not emotional people making some emotional statement. On the other side of this, we have a large contingency of propaganda that's trying to talk to you about getting vaccinated. And so we are at a crossroads. There's always a crossroads in between God's man, God's people, and the enemies of God. And I believe that this subject matter, the vaccine question, is that delineation between God's decisions, God's ideas, versus the enemy or Satan's ideas and Satan's suggestions to us. And so that's why we're having the show. And that's why we are here to be very serious tonight about what my sister has been seeing in the ICU. So you want to take it from there. What has been your experience as far as how you've seen the transition from the last time you were here? You were so overwhelmed with what you were seeing and the work that was required of you to take care of these COVID patients. It was wearing you out. It was wearing you down physically. You were concerned about yourself with your physical and emotional health. So from there to today and what you are seeing now that we have gotten into the vaccines, how would you sum that up?
Well, I would say from the beginning, we had no idea what was going on whatsoever. You know, that was the narrative that was at the bedside. And I just wanted to let the people know all honestly, as in general, your healthcare providers today don't know. We are just in the dark as you are, your nurses and your doctors. They're not calling the shots. They're not making any decisions as far as protocols. That stuff is coming down from the government and higher people around, but not from your physicians. And we are just as vulnerable as you are, and being not informed. So being at the bedside and actually seeing what's going on. So from the beginning, the protocol was to put everyone on a ventilator. We were not used to seeing people O2 saturations, meaning their oxygen level within their body at 72%. And they were talking to us. The normal range, we would like to see that above 92% to 100. So at 77, a lot of things can go wrong. You can go into cardiac arrest. You can have a heart attack where we have to intubate you and code you and things like that. A lot can go wrong with O2 saturation at 70. So we wasn't used to seeing people living like that, especially with so many other comorbidities that they had as well. So they already were sick, and now it's nothing we could do to get their O2 levels up. And so it was put them on a ventilator. And what we do know about that mechanical ventilator is that you put a healthy person on that ventilator, they have an 80% chance coming off that ventilator, a very healthy person. So this very, very sick person, putting them on a ventilator, a lot of people died. And so now that we can look back in retrospect and we can say, you know what, a lot of people die from ventilator related deaths and not necessarily COVID. Because today that is the last resort. We do not put people on the ventilator. They go on high flow nasal cannula oxygen. They go on just oxygen in their nose, CPAP, BiPAP. We do everything possible before we put them on that ventilator. And now people are walking out of the hospital, even with multiple comorbidities, underlying illnesses. They are walking out that hospital. They are living. So COVID actually have a 95%, if not higher, survival rate.
Yes.
And we have to say the facts. The facts is that was the wrong protocol. That was the wrong call. And once again, that was the call made not by your doctors, not by your nurses, not by your healthcare providers. That was made from above them nationwide. Right. So but it was your physicians who advocated for their patients and who had suffered, who a lot of them knew that was the wrong protocol and they fought back. And so now nationwide, we're seeing doctors taking charge and saying that's not what we're going to do. And then the other part, you hear a lot of things in the media about this experimental medicine. I've never seen any experimental medicine. America doesn't have any new medications. I've only, what I've seen at the bedside, what COVID patients are being treated for is their underlying illnesses. You get hospitalized not because you have COVID. Get hospitalized because you can no longer manage your underlying illnesses, such as diabetes that has gone out of control, and now you're being hospitalized. And so we try to race and fight because COVID acts like an opportunist. COVID loves us sick.
Yes.
And so we race to fight to try to manage the underlying illnesses. In the process, the only thing we give you for COVID that they've learned to help with COVID, to slow COVID down, is vitamin C, zinc, thyme, D3, and also covalent plasma. A lot of times you are given plasma, and that plasma actually comes from a lot of your healthcare providers who have survived COVID. And so that's the only thing I've seen. The big hype about hydrochloroquine, I saw that in the very, very beginning. But I saw that being used with sickle cell patients or lupus patients, which normally it is used with those patients, because they were also one of the population that was affected the most with COVID, because once again, they had an underlying illness.
Right.
So, and by the way, newsflash, it didn't work. I'm sorry to say at the bedside, it didn't work. And the proof that it didn't work is that we're doing something different and people are walking out the hospital. Right. That's the proof that it didn't work. So, so let's go forward. So today, COVID, seeing less of COVID, we are, COVID numbers are down. And I truly believe that's because we're managing it better. Social distancing, wearing the hand hygiene. There have been great restrictions. We're not gathering like we used to. But let's get something very clear, because we'll say, oh, the youth still gathers, the youth still does this, the youth, even goes to Summerfest during spring break and things like that. Well, we never saw that age group affected from COVID. So let's keep that real. We've never. COVID, period, loves obesity, diabetes, hypertension, HIV, sickle cell, your underlying illnesses. Let's not exclude obesity. COVID also loves your older population, which is the weak. We've never seen that age group. We've never seen younger children and younger adults being hospitalized with COVID. Have they had COVID? Yes, and they beat it like it was nothing.
Right.
They definitely were not hospitalized for it. So now moving forward, so now you see we're managing it better. Praise be to Allah. We've done great restrictions, so people are healthier. So now we have this vaccine. Now we're seeing more vaccinated people admitted in the hospital, fully vaccinated people.
Right.
So they get their first shot and they normally experience, and I don't know not one person yet that has reported that they did not experience nothing, okay, or anything at all. So you get your first shot and you experience like fevers, chills, redness around the arm, and they're telling you that that's normal. Or you have an extreme fatigue or tachycardia where your heart is racing out of your chest and things like that. And I know, as Dr. Keeley would tell you as well, is that when you have symptoms like that, those are the same symptoms and illnesses that you will need to diagnose you for a disease. So, I mean, that's not good. It's not something to boast or brag about, especially since we are surviving COVID, and we have survived COVID for the last 18 months. That's not something to boast or brag about. It's sort of like you were fine today, you start coughing, and you wake up and the next day you're coughing, you will say you're sick. So if you took a vaccine and you have symptoms, you're sick. You're sick. You have something going on. So diarrhea for 7 days is not normal. And we're seeing that. People say, well, I had diarrhea for 7 days. That's not normal. That's not okay. You actually deplete potassium out your body, which will send your heart into a irregular rhythm. And that's what we're seeing. And so now you're sitting in the hospital with me, and we're putting you on some type of cardiac drip, like amnion, to get your heart back into a regular rhythm, because you've had diarrhea for 7 days, you're low on potassium, you're low on magnesium and things like that.
Right.
So we're seeing a lot of that. And the other part is that just recently, which I believe is so terrifying, dear brother, is that COVID vaccinated patients, not all, but I've had myself personally 3 of them who have had some bizarre symptoms, and the doctor has called to put them into isolation. So the first thought, as a healthcare provider, I would say, why we have these people in isolation? Let's make it clear, they don't have COVID. We didn't put them in isolation because this spike protein or therapy they gave them, called a vaccine, gave them an immune boost for COVID, and now they're sick with COVID. No, physicians don't know what they have. And and asking the infectious disease doctor, why is this patient in isolation? The only answer is because they're infectious. Possibly, that's what he said, possibly infectious. That's terrifying, because I'm not vaccinated. Don't plan on getting vaccinated like most of your healthcare providers. So the news is reporting correctly about your healthcare providers. 60% of us are not vaccinated and have no intentions on getting vaccinated. Right. And that's because we are witnessing firsthand the horrifying effects from the vaccine. Now, you talking to a nurse who just said, I look at COVID all day, every day. It never horrified me. Vaccinated symptoms horrified me, scare me. It scares me.
Yes, ma'am.
Because when you have doctors at the bedside and you can't explain why this patient is red like a tattoo from the wrist all the way to the shoulder on both sides, which means it's systemic, means whatever's going on in his body is going on all over the body. It's not an allergic reaction just on this side. And then you tell them Yeah, let's put him in isolation because you've never even seen that in your textbook.
Mm.
Your medical degree cannot treat that. You've never seen it. You don't
Right.
know where to begin. That was never the case with COVID. That's never the case with COVID. You had all kinds of speculations. Oh, it looks like the flu times 10,
Mm-hmm.
and now, like I said today, they're managing it better. You're not going on a ventilator. Therefore, more people are surviving. What are we going to do about these COVID vaccinated people with things we have no idea what's going on? We have
Right.
people walking in that their ALTs in the 4,000. That
Wow.
means liver failure. But guess what? Their liver is fine.
Right.
They're doing every test possible and it's, oh, the liver is fine. How about all the clotting factors in women? Generally, women are being infected with that the most I've seen, not so many men. We're talking about severe problems. So they get a clot, they get what you call a PE in their lungs, possibly can go up to your brain, you stroke out, things like that.
Right.
But for women are having adverse effects as far as being on their menstruation too long. And then they're also clotting, causing devastating effects. I had one patient that was talking about getting rid of their arm.
Wow.
Literally, that clot was sitting in their ulnar and brachial vein, and it couldn't get rid of it, didn't want it to travel, but then their fingers losing all kinds of circulation to their, fingers.
Yes.
So, I mean, it's that, and how do you treat that? What do you do? They're literally teeter-totter. So we put you on a blood thinner, you start bleeding other places, but we're trying to dissolve this clot, but you're bleeding other places. So that's what I mean. They're at a loss. Yeah.
That's crazy. I know you have plenty of other things because you and I had talked about some other cases that you didn't mention today, but we're going to come right back to you, sister. Brother Abdullah, are you there? Brothers and sisters that are listening, first, I just want to thank you all for coming in. I think, as you can hear, I think this is a very important program. I just want to briefly mention that for those of you that like to support your own people and our platforms, please go right now to blackstream.live, blackstream.live. I am streaming there. That's a Black-owned streaming company. And when you get there, go to channel number 2. You'll see a bunch of like chef capes, I call them, a chef apron, should I say. That's better than a cape. If you go to channel number 2, that's my channel, and you will see this. This is where I'm going to start eventually working towards doing my streaming solely. Not right now, but eventually I want to go where I'm supporting this company because this is our own people growing something that I think is going to be beautiful in sometime in the future. And if we have the type of mind where we want to support our own, we got to put our feet where our mouth is, right? So that's what I'm trying to do. Brother Abdullah, Dr. Abdullah Pratt, how you doing, my brother?
I'm fine by the grace of Allah. I pray all of you all are doing well. I pray Sister Tam is doing well as always, and it's truly an honor, and it's good to see both of you all's beautiful faces.
Well, you as well, my brother, and I'm going to have to say this about you as well. Brothers and sisters, this man is a hard-working, not only ER physician, and I told you all, with my experience, after 26 years in this field, the 2 most difficult places that I know of in the medical field are in the hospital, in the ICU, and the emergency room. There is nothing like it. So this brother is an ER physician in a prestigious emergency room in Chicago. He's also a husband, and he's also a father. And so he's very busy. I appreciate him taking some time out. And as I said about my sister, I don't bring people on my show that I don't respect and don't have admiration for, and do think that it's worthwhile, that the information that they have to say is something that we really need to listen to. So I'm just going to ask you the same question, my brother, and then give it to you. The last time you were on the show, we were in that phase of inundated with COVID patients, didn't really know exactly what we were comfortable with. There were so many different things. This side of the country was trying this, these people were trying that, another country doing something different. And we were having so little success, we really weren't sure what to do, but we were trying, right?
That's right.
Now we're at a different phase. As Sister mentioned, we don't really have to run too far to have a set protocol for a COVID patient, and we have enough options where we can try some different things depending on what state they're in. But we're also now starting to look at 6 months of a reality of a vaccination, a new vaccine. And so I'm just going to leave it there. Talk about what you kind of were sharing the last time, if you can remember. I know there's been a lot that had happened, but just talk about what it was a few months ago to now what you are seeing now that the vaccines are in full effect. Please.
Of course. So I think that, as this pandemic has progressed, it initially started off, especially in emergency departments, as you all just had a conversation about, with a management of resources, controlling how things operated. So, we all used to get fitted for an N95 mask or a PAPR like I usually do because of the beard. And those things, especially those masks, used to be one-time use only. One-time use, throw them out. They were very strict about that kind of stuff. Yeah. Pandemic hits, it's like, oh, well, maybe you could get away for a week. Then it's like a month. Now it's like, hey, this is just yours. It's got your fingerprints on it. You can bake it. You can step on it and cut it up and do whatever you need to do to get it to work again. And then it was like, hey, just handkerchiefs. And it almost got to a point where it was like, listen, if you just cover your face, you'll be okay. But I think that was a microcosm for what happened with the ventilator crisis. And unfortunately, even though we may have gotten to a point of stability in how we manage it in the ER, part of that because of the numbers have been more favorable for us, and you all talked about some of those reasons. The other part is just that, people know what to expect. People know, almost like that gut feeling that you get just from experience. When you experience something many, many times, you start to have better indications of who's going to do bad, who's not going to do is bad, what you can get away with. Being able to use non-invasive positive pressure ventilation. So the high flow nasal cannula was a revolution. And it was something that, if you remember, it was restricted from use because of the theory that it caused more aerosolization or more droplets to be in the air, and that put healthcare providers at risk. When now, in retrospect, many of us see that as maybe something that, could have led to more lives being saved, even in that first wave. And it's not as invasive, it's not as risky as actually intubating someone. Unfortunately, we now, and my prayers go out to all of the people there, but now we see the same but different bottleneck happening in India, where you have such a high population density, and many of those people, just as here in America, in a similar way, are subject to the caste system, where the poor and the darker people are forcibly restricted from any upward mobility. So those people, their numbers are probably not even being counted right now. I have numbers of colleagues who have, roots over there in India, who have family members who are suffering that they know of, and it's oxygen actually being limited. We're not even talking about intubating and all of those things. Just actually being able to deliver oxygen to people is what they feel like is leading to so many different deaths. And so I think that here in America, we have gotten to a point now where we're progressing through the phases of what a pandemic looks like. And many of the fears, and I wouldn't say I necessarily have a fear about this, but the fears collectively within the medical system deal with what happens if the mutations continue and they get to a point where not only is the infectivity rate higher, which is what we're seeing in the new strains down there in Florida and Michigan and other places with the UK variant, but what if now its actual potency and its actual mortality and morbidity rates go from being fractions of a percent to like 1%, death rate? Or what if it becomes a 5% death rate? You're talking about a completely different scenario that we be faced with, both as people, also as providers. Providers were pushed to the limit in this last year. We got pats on the back and called heroes, but last time I checked, our student loans are still there. Last time I checked, our families are still struggling to accommodate to all of the pressures that this has taken on us. Last time I checked, we weren't getting a bunch of free therapy sessions or any Dianetic sessions that were personally scheduled for us out of our work schedule. These are the kind of things that I think about when I'm thinking about my team, the residents that I manage, the students, all the way down to the patients. Is if something were to happen, now that vaccine is probably going to be rendered, effectiveless. And this whole conversation that we're having becomes for naught. And I think that that's something that people should keep on the back of their minds, is this: think about how far you were pushed, and we got a couple of stimulus checks and you got some crumbs off the table and whatnot. But at the end of the day, if you push that number to a higher number, those things may not be there, right? Like, you may not be looking at, how can I pay for, this or that? How can I spend my tax check? You may actually be looking at something that stresses the fabric of our society to the breaking point. And so those are the things I think about. I keep in the back of my head from a top-down perspective, but on an individual level, in terms of what we're seeing in the emergency departments, of course, it feels to us like we got somewhat of a handle on many situations, but unfortunately, we still get people who come in who are critically ill. Young people, even still, many of them have some type of comorbidity or another, ranging from autoimmune diseases to sickle cell to, obesity, smoking history. You probably be able to pull something out of there, that they have some risk factor toward. But even in a perfectly healthy, even in many believers that I take care of right here in Chicago headquarters, I see young people all the way to the old who contracted. And many of them, and in fact, all of them recently have fought through it successfully and have made near full recoveries. But in terms of the vaccine, as we see a growing percentage of people who get vaccinated, the quandary in the back of our head, the question that remains for many of us providers, and it's something that's not being covered in the media, is how many of these people who are contracting COVID for the first time, some of them becoming critically ill within the window of getting the vaccine, what's the relationship there? And I think it's a natural question, but we also simultaneously play devil's advocate. So we'll say, hey, you know what? A greater percentage of people are getting the vaccine. So whatever we see may have happened anyway, and we're just seeing it because now more people get the vaccine. But that's a hard sell to the families of people who are losing loved ones. I'll tell you that. I'll speak personally from that point of view. I can't tell you whether the CDC is releasing the real numbers or not, in terms of adverse events after vaccines, as well as catching COVID, what they call the breakthrough, after you've been fully vaccinated. Families, those are tough conversations. I had one recently about a week ago from a young lady who lost her life, who was not too much older than I. And we didn't know why. We fought for her. She came in cardiac arrest. We didn't get it until I saw her x-ray during the cardiac arrest. And I was like, this looks like horrible COVID. And, it kind of reminded me of where we were about a year ago. And we hadn't seen that too much. But back then, that was how we were almost able to confidently diagnose people. Symptoms, chest x-ray, CAT scan, even without the CAT scan. I see that chest x-ray. I see those ground glass opacities in the type of pattern that they normally exist. And I'm like, this is COVID. You can, people would be taking friendly, non-wagered bets. Like, hey, man, what do you think this is COVID? And it's like, hey, it probably is. Everybody would agree. I'm starting to see that a little bit more. And when the family member says, hey, she got a vaccine, both of them, and about 3 days after that second dose, she just fell off a cliff, man. And I don't know what happened. Those are the kind of things that cause you to pause. Strokes that we're seeing now, to seizure thresholds being reduced in epilepsy people. I'm hearing experts start to say, in terms of our consultants, to actually go on record and say, hey, this may be an effect of the vaccine. And I think that that's fine and dandy. I think that if you go from the perspective of, our CDC and the powers that be, that, hey, you're going to expect some type of adverse events. I just find it, very ironic that there's no guidance. There's no anticipatory guidance in that to say, hey, listen, if you have seizures, if you have certain blood-borne illnesses, things like that, specifically go at those and say, hey, you need to talk to a doctor before even considering the vaccine. And I just don't hear that. And, and I get that feedback from the patients that I take care of, who are nearly 90% African-American here. So we're seeing it all. We're seeing the TTS, or the thrombosis with thrombocytopenia. And we're seeing our hematologists give a great deal of respect to that. That is something that I've at least taken some comfort in, the fact that the physicians themselves haven't bought into any kind of closed-mindedness. There is a very investigative, like, hey, whatever you see, don't just gloss over it. Like, that may be something, anything you see from any organ system point of view that's out of whack and it's in the context of this vaccine, don't just write that off. Get us involved, consult us, because it's something that at the very least we should track someone, and even furthermore, we should study it and try to figure out exactly what's happening, because clearly this isn't being reflected in the media.
Wow, powerful, both of you, just a powerful testimony. I want to just mention something. I'm gonna put it right back in you all so you all can give the people some of what you got. You know, I've been telling people that to drive in some of the many cities I've been over the last few months, checking on family members, being involved in those that are trying to make it through whatever they're going through. I'm looking at some of these vaccination tents and some of these mass vaccination sites in Texas, Georgia, California, North Carolina, all these states. I've seen them. And I keep having conversations with people that for the government to put, because that's really what's doing this. All these different vaccination sites that you see are government oriented or state or a combination of the two. And they are foregoing the ability of your physician to think through what is going on with you and steer you in the right direction. And so I think that's a huge issue that we should be discussing, because similarly, I think all three of us have been in healthcare long enough to know when there weren't commercials about drugs that you get from your doctor. You may have seen a Tylenol, aspirin commercial when I was coming up, NyQuil, things of that nature. But I never remember as a young boy, nor as a teenager, being able to sit in front of a television and then come out of the television show or commercials and say, I'm going to ask my doctor about this drug. That wasn't a reality. We're slowly seeing this change. Now, I don't personally think that that's 100% a problem, because the medical industry hasn't proven that the general public should trust them. That's number one. Number two, though, the problem with it, that is, you don't know what you're listening to. You don't know what that medication is for. What are the side effects? What is the true reality of you as a person taking it? And does your demographic, your age, race, comorbidities, your just reality of how you take care of yourself, how does that play into how this medication is going to affect you? And so that's the same thing that we're dealing with this vaccine. You have all these vaccine places that you can just go and make up your mind that you want to take a vaccine, but do you know how to put it in context? And one great example of that is my family. I have plenty of people in my family, I can go down the list, who call me if they're in trouble, they got something going on they don't understand, family member in the hospital, they call me. But yet the majority of my family members have taken this vaccine, haven't asked me nothing. Probably one of the greatest decisions that they made that could have the worst effect on them, and they didn't reach out to me. Where did they get their information? How were they able to delineate it? I don't know. But that's a problem, I think, in this society. So I'm going to do a couple of shout outs. I'm going to come right back to you all with that question. How would you deal with that? Khalila Muhammad, Legacy 2, Tiffany Muhammad, Joe, Lion Rules the Jungle Muhammad, Regina Muhammad, Tiffany, James Williams, George Allen, Hazel Muhammad, B. Coop Boy, EP Hope, Legacy 2, I think I said you already, Darlene, Jamil. First of all, thank you all for coming in. Wa alaikum salam. Good evening to all of those that are listening. I pray that you are getting some excellent news that you can use. So I'm going to put it back in you all's hands. Depending, or let's say that we look at a personal family member of ours that is in some aspect of this threshold of lost their smell and their taste versus at home trying to fight it and starting to become hypoxic. Would you consider the vaccine, and anybody that you know, anybody that you love, or anybody that would be under your influence? Go ahead, Sister Tamara, you take that one first, please.
Yes, awesome.
And if not, if yes, why? If not, why?
Okay, yes, sir. I wanted to give brother the greetings. Good to see you, dear brother. Eid Mubarak. It's a pleasure as well. Thank you. I hope you can hear me. But so your question was,
Brother Abdullah.
yes, Brother Abdullah. Your question was loss of taste or smell, or getting hypoxia, or if taking the vaccine.
No,
Okay.
no, I'm saying if you had a family member who was somewhere on that continuum, right? I mean, I know some people who have gotten loss of taste or loss of smell and had no other symptoms.
Mm-hmm.
I've also had a brother who was in the hospital for 9 days thinking he wasn't going to make it.
Right.
So I'm asking if you had somebody with mild symptoms or very severe, like very severe symptoms that may potentially put them in your side of the hospital, would you suggest or would you consider suggesting to them take a vaccine?
Okay.
If yes, why? If no, why?
Okay. I'm gonna say no, because I've taken care of patients who are completely vaccinated with COVID, who contracted COVID.
Yes.
And we gave them the same protocol that we would give them a person who was not vaccinated. The only difference is that we don't know particularly what is wrong with this vaccinated person. They come in with what all of us would say bizarre symptoms.
Mhm.
That's one reason why. Okay. Bizarre symptoms to, like you just heard Dr. Abdullah say, don't glaze anything over. Look it over. It may be something you don't know. That's how healthcare is going right now, because people are coming in vaccinated and they don't have any other say illnesses or any history that can back up what's going on with them. And then they're going down so fast, you're wondering what was really happening. So I would say no, at least with COVID, like you just heard Dr. Abdullah say again, they would like to believe that they have a better grasp on it. They are managing it better. You're not going on the ventilator, okay? I'll also say with a person who worked with COVID, I'm not suspected exposed. I am exposed.
That's right.
I'm not vaccinated, okay? I take more precautions walking into a vaccinated room today than I would a person that's completely vaccinated than I would a COVID patient. And that's the honest, I'm telling you the truth, because we have no idea what that vaccinated person has today. None at all. And then and these are young people, just by the way. So as I said before, we didn't see a lot of young people with COVID hospitalized. Did they get COVID? Yes, but we did not see them hospitalized. Are we seeing young people today that's totally vaccinated that has COVID? Yes. That has other illnesses we have no idea what they are? Yes. Like I said, there was I had a nurse that took the first shot. She was yellow. She was jaundiced, completely jaundiced. We had no idea why she was jaundiced. None at all. They did all the liver enzymes. They did everything possible. She was off for a whole week, and she was yellow for a whole week. So how can we explain that? And then from then she just kept not feeling herself, to where now she took off. I have another nurse friend who took the vaccine who experienced foot drop. Okay, those are those neurological effects that
Right.
Dr. Lewis is talking about. He experienced foot drop. I mean, now he's completely debilitated. He cannot work anymore. And that's just after the first dose. And then, like Dr. Lewis said, where is the anticipated guidance behind this? He was told to go ahead and take the second shot, where he experienced this extreme adverse effect. And now he's like, well, I started the first one, I might as well take the second one. And then if you look at the CDC website, they'll tell you that you're going to experience some type of adverse effect or signs and symptoms, and the second shot is going to be worse. Guess what? They're not lying to you. It is. I've seen it. It's going to be worse. Whatever that worse is, don't know. But they're not telling you not to take the shot, not to take the second shot. They're even advising people who have all these comorbidities. Remember, again, let's make it make sense. They're advising you to take this shot even if you have all these comorbidities, but you were the one that was most at risk for COVID. It just don't make sense. You were the most person at risk who had diabetes, hypertension,
Right.
Later in age. You were the most at risk, and now they're telling you to take the COVID shot. Here's the thing: you come into the hospital and you have this bizarre symptom. How are we going to relate that to something you are already sick? How can we say, they're saying people are testing false positive for HIV. Think about that. How are we going to say, oh, they didn't live a promiscuity lifestyle? How are we going to say that was from the vaccine? You know, I cannot say the physicians I work with are not apt to say that out their mouths publicly that was related to the vaccine, but they are walking around scratching their head and talking to one another and everyone else and saying, where else we're going to point to? They don't have any prior history of anything. So where else can we point to? Especially the young women who are coming in with DVTs and PEs. They have no other history, but they're sick.
Pulmonary embolism, for those who don't know those terminology.
Yes, that's what that is. Very dangerous.
Yeah.
Very, very dangerous.
Deep vein thrombosis is what she meant by DVT, and PE is pulmonary embolism. Those are blood clots. DVT is usually in the lower extremity. The PE is when that blood clot breaks apart from that area that it is and can travel to your lung, lodge in your lung, and then you start having severe breathing problems. Go ahead, my sister.
Yes. So that would be and the other thing too, you have survived COVID. We don't know if you will survive the vaccine. That's anything that's puzzling your medical world. And they're literally saying, I didn't read that in my textbook. I didn't learn that in medical school. I don't know what that is. Like I explained to you, the man that literally looked like he had a red tattoo from here to here. And it was systemic because it was on both sides. How do we treat that? Where did that come from? What happened? But one thing we do know for sure, because people come into hospital today like a badge of honor. I've been vaccinated and we're holding our breath. Oh, you have? Oh, we don't know what to do with you.
Right.
You know, we're like, wow. And they see it as, you know, I'm good. You know, and that's exactly what he said. He'd been vaccinated. And literally it's like literally 14 days after that second shot. That's typically what we're seeing as a trend, literally as a trend. Oh, okay, 14 days. We don't know. We don't know what's wrong with you, but there is a bizarre adverse effect that's going on with you.
That's right.
So, yeah.
And I want to make something clear. You know, I've heard a lot of people.
I'm sorry. I want to say this.
Yes.
All we have to do now is wait 6 more months like we did with the COVID. So what we know today is that COVID has a 95% survival rate today. Even the CDC says that, okay? But let's look at all the people that's coming in with vaccinated adverse effects. It's like right now, the way we're starting off, you have a higher percentile rate of contracting something or having something that your physicians don't know what to do or treat than if you had COVID or when COVID has started. And like you also heard Dr. Abdullah say that there is better management today. So people are surviving COVID, but they don't know what to do with the vaccinated patients. That's scary. And so Dr. Abdullah also talked about the mental health of your healthcare providers. I am, for one, like Dr. Keeley said, that works in ICU and also throughout the hospital. I'm tired, like so many other healthcare providers. We're sick of the false information that's going on in the media. There's not a lot of advocacy for your healthcare providers. No, like I said before, they're in the dark as well. It's terrifying when your infectious disease doctor tells you to put a completely vaccinated person in isolation. Imagine the fear behind that. You don't know what this person has.
Right.
So there's a lot of instability in your healthcare system today when we talk about mental health as well.
Yes. And I just want to make something clear. I know some people may be asking me, why would you ask these providers about a question like that? Because I do not want anybody to think that the minister, nor we in the Nation of Islam, are anti-vaccination. We're not. The minister didn't say, don't ever take a vaccine. He said, don't take this vaccine.
Right.
And the reason is because we can't trust the people that are producing it and promoting it on the people.
That's right.
And so that's why I'm asking this question. I just wanted that to be clear. So again, anybody that is interested, blackstream.live, check it out, channel 2. Brother Abdullah, same question, my brother. Would you, depending on those parameters, somebody as mild as just losing their smell or losing their taste versus somebody that you felt potentially could wind up in an ICU type situation, would you suggest this vaccine to anybody?
I think the number one, you know, there are a lot of different factors that go into it. But if someone's starting to get on the verge of being critically ill, I think that there definitely has to be a cost benefit and pros and cons type of approach to saying, hey, how much and I think we should step back. The vaccine is not a treatment, right? So it's not something, and not even in theory, no one has claimed that. That's not out there. So I don't know if that's a misconception about how vaccines in general work. But you wouldn't say, hey, you're sick as a dog, and we just gonna give you a vaccine and that's gonna fix you. There's no doctor saying that. Okay, I hopefully, none that I could think of would be in that position. I think that there may be, some doctors who see you as mild enough and they say, you know what, we think you should get the vaccine anyway. We don't know what's going on with these strains. And I think for those patients, I get those questions, right? And I'm always like, well, I'm going to help you get the facts about what's going on. I can't tell you what to do unless you ask me, what would you do personally, or physician aside? But I think that you have to have the facts to say, this is the disease course, you're already infected with it. To some degree, a vaccine is only a secondary measure to actually just being infected with something, in theory, right? So in theory, we all learn that a vaccine is just a way for you to mimic actually having contracted the disease. Right. In your body formulating the memory type of immune response to that disease, but you're taking less of a risk than just actually getting the disease. So it's almost like taking a practice test before you take a real test, without saying, hey, I went and took the real test and failed it or beat it. Now I'm trying to get a better score the next time I get it. Yes, so I think that's the background in terms of how vaccines work. And so, there may be a number of different medications that someone would qualify for that I would be reaching for first, right? Like, I think you have to manage someone's oxygenation first. You have to make sure that they don't have some type of severe pneumonia. You need to make sure that they're not about to head into some type of cytokine storm, which is your body's own immune response inappropriately to the infection, which can actually cause the type of severe damage to the lungs and other organs that usually people in the ICU who go on to pass away, that they start showing symptoms of. So I think there are a lot of things on the list of to-dos that us physicians and staff would be looking at to say, are we doing this? Are we doing this? Are we doing this? Before we even get to that level, And so I would say that in that situation, I'd have to see all of those other things checked off before I'm even willing to have the conversation with someone about whether or not a vaccine, like, it's just so preposterous that would be the first thing that someone, when they're admitted, asks, but that's what's happening. So I get where the question comes from, because I do get that question in reality from people who I know in the community. And that's the way that I approach the conversation. Well, let's look at your chart. What have you had done so far? Where are you exactly at? Do I need to speak to the physicians? Can this wait if you're very, very pro-vaccine? So if this is something that the patient wants and they're asking me, hey, doc, do you feel, I trust you, I've known you since you were a child and whatnot, how would you feel this is okay for me? And these are the things I would have to go through, as well as understanding a physician's reasoning before even approaching that question about a vaccine, because at that point, the benefit to you may actually start approaching the same as the risks, right? And I think that right now, as we look at risk versus benefit of the vaccine, if you just trust the numbers that are being put out, I think that many can still make a case to give the vaccine, right? Like, they're saying that, close to 100 million people as of, the turn of this last month. So at the end of April, in the United States have been fully vaccinated. That's what the CDC shows. And they say of that number, about 9,500 have had what we call breakthrough infections. Now, you have to remember breakthrough infections. So that's a small percentage. But you have to remember that breakthrough infections refer only to people who have been fully vaccinated and the 2 weeks after. So when you start looking at this number, plus the people who are getting infections before they're fully vaccinated, and you add to the number of people who may have had these adverse events in any way that aren't actual COVID diagnoses, then that's the kind of numbers we need to see. But I haven't seen much that have compiled all of those numbers to actually say. But even then, it would still be hard for me to see, based on the numbers that they have, where, excuse me, our government and the CDC may not still be able to recommend going forward with the vaccine. And so I think that that's something that people need to realize, is that there, losses and collateral damage are an acceptable loss if the powers that be feel like that's what we need to do. And so I think that's why it's important not to just like say, oh, well, there's another reaction. this just, pile on, but to actually equip yourself with this information so that as you are presented with these different decisions, right? If you do have somebody who's very ill, the vaccine will be pushed heavily upon them, right? And I think that for certain people, it's a fair decision. If you're not a Nation of Islam believer, or you're not a complete anti-COVID vaccination type of person, or conscientious objector, as I like to call it, then you may actually be teeter-tottering on it. And for most of you all, it's probably going to be your family members, right? Your family members who may not exactly believe 100% what you believe, right? Maybe an aunt, a cousin, a brother, whatever the case is. And this is going to be how you have to approach it. So I like to equip people with tools that they can actually use in this real scenario. And I say that the best thing you want to do is remember that as a patient, you are in the driver's seat. If you feel like your care is happening, except in the very, very emergency scenarios, if you feel like things are happening that you don't understand or that are moving too fast for you, then you need to be advising that person or yourself to really say, hey, what are the data? What would be my risk to actually, what would happen if I caught COVID percentage? What would happen? What's my percentage of getting an adverse reaction? What's the likelihood that I may still catch COVID after this? And from the perspective of a physician, how long do you think this vaccine, if it works, will work? And so I think that that's where I'm at. And I think that, I'm always trying to help people navigate those very real discussions, not theoretical, not this is what I'm going to put on my Facebook banner and say whether go get vaccinated or not to go get vaccinated. But seriously, when you have to be accountable to what somebody goes through afterwards, it's a little bit different. And I think that the safest thing for any of us to do, because just as you all both eloquently stated, we just don't know everything, right? And that's okay to say. And I think that we've gotten so far away from that. And many of my colleagues have been pushed, especially African Americans have been pushed to try to go out and advocate for the vaccine so heavily that now it may be putting them in a difficult position to walk that back, even if it's just a little bit, even if it's just a, hey, I did put that picture up 1,000 times of me getting shot in the arm, but hey, man, listen, there are some things you should take into consideration because now your credibility is in question. Right. That's tough. That's a very difficult position. And unfortunately, it's happening at the highest levels to African-American physicians, because you have to think many of us at big institutions have never had that type of presence and rollout on any issue that's not even controversial. That's right. Whether it's maternal fetal health, whether it's mental health, whether it's violence like we see here on the south side of Chicago, no matter what it is, diabetes, reading a food label, right? You could roll every Black doctor out and say, hey, we want you to learn how to read a food label, and you get no pushback. There's no controversy about that kind of thing. Yet you never saw it. Right now with COVID, you saw it. And now it seems like, and I'll tell you, just behind the scenes, it seems like that if we start to have more questions, you start to see more vaccines pulled, or even if in the worst case scenario, and I pray that this doesn't happen, there are the type of mutations that then render this pointless, there will be that conversation is going to have to be difficult to say, hey, we didn't know everything. And maybe we should have told you all that, but we were trying to just really get people engaged to actually go do it. But yeah, we are starting to see these blood clots. We are starting to see people still come in with COVID, even though they've been vaccinated, whether it's partially, fully, or not within the full time frame. And you should know about these things. But unfortunately, that was never talked about because of the fear that that would cause more hesitation and give more fuel to the fire of those of us who have been always on the skeptical side of things, whether we got it or not, whether our families got it or not. Many of the doctors that I know got it were very skeptical still getting the shot. This is why so people passed out after the shot. It wasn't really necessarily a physical thing all the time from the shot. It was because there was so much pressure around this to say what is going to happen. It's almost like going on a roller coaster and leaving the rail a little bit too high, right? Like, hey, what would happen if I just left it right here? In that kind of reaction versus you feeling super secure in what you're doing. That was what I saw. So I think that for those of you all who are watching, that's the important part of this, is that really you want to become knowledgeable. You don't want to fully develop an opinion, right? We have a stance, and everybody has a stance on it. But I think that all of us should be in the process of gathering that information in the same way that our beloved minister is, right? His humility is always there. And he challenged many of us in the nation who are physicians and scientists to go out and try to research these things. And he was in the order was not to take it, until this has been fully vetted and researched, forgive me for my paraphrase. So I think that that's where I'm at with all of these things, you know. And remember, when you see COVID, that can be a very, very fearful thing for those who are very, very ill. And it is a small percentage, just as the amount of these adverse reactions are a small percentage. But you should know that as well. And sometimes it may come down to a business decision, you know, and I don't blame you. I don't judge anybody for whatever their decision is one way or another. I just hope and pray that we are all as informed as we can be. And that's the goal of many of us on this side, is just to make sure that you're extremely informed and that you feel secure when you make the decision to the best of your ability, that you're making the right one for you, or that you're giving the right advice to a family member.
Yes, sir. Excellent. Brothers and sisters, I know there are a few comments and a few questions out there, but we have to get up out of here today because today is the Honorable Minister Louis Farrakhan's birthday, and there is a wonderful show that he is bringing. I'm going to show you this fly. Didn't come up. I'm going to get it up in just a second, though, but I wanted to just say, I asked that question, and I did not have a conversation with either one of my brother or my sister to predetermine what we were going to talk about. I spoke with both of them within the last week or two. I wanted them to come on this show and share with you the information that I heard. And the words that they use, as they use today, bizarre, strange, haven't heard of it before. That wasn't in the medical books. That was never in any training. When we think about those type of words, the aspect of COVID, those things are starting to go away. We're not using words like bizarre, strange, with the infection from COVID-19. Those things were used in the beginning of this pandemic, but now we're starting to use those words with the vaccine. But as practitioners, we don't always have a person who believes the same way we do come to us to seek advice. Sometimes it is a pro-vaccine person. Hey, doc, what do you think about this? We don't necessarily, well, I shouldn't say we. I can speak that I'm not a person who pushes medications. I push holistic treatments. I suggest holistic lifestyle. But that doesn't mean that a person doesn't come to me and ask me about these different medications that were brought out during COVID. They are experimental as well, just like this so-called vaccine. And so my point is that the reason why I asked that question is because it's not about what we stand on. I know these two people. I know the decision they're going to make about putting a needle in their arm. But there are people that are going to listen to this show. There are people going to hear this information that are not members of the same reality that we believe in. And the information, I think, is so critical that we have to pose it in a way. We have to put it on a platter that makes sure everybody can take this information and use it. Because I don't know a lot of places that you can go get information. I'm just being honest. I'm not trying to pat myself on the back. I'm trying to pat them on the back, though. But I don't know a lot of places where you can go and get this type of information from frontline people that are going to come and talk to you without fear. Because the reality is there are a lot of healthcare practitioners across this country that are afraid to speak out because they don't want to lose their position. They don't want to be marked in the medical industry. And you don't want to be the person that everybody's looking at when you're at work, because you have no idea what's going to happen to you in a medical setting where people know things that could harm you very quickly. This is the reality of life. And so I appreciate my brother, my sister's courage and bravery to be unwavering, because they said it to you all the same way they said it to me in private conversations, because that's when they exposed it to me, was in private conversations. And unfortunately, you all don't realize that a lot of the private conversations that are happening in the hospitals and the so-called prestigious institutions that you live near, they're not coming out publicly stating the type of things that you're hearing today, the type of things that can help you make a decision that would benefit your life or harm your life if you make an ignorant decision. And so that's how powerful this was for me today, and important it was for me to make sure that they came. So I just want to show something very quick, and then we're going to make our closing statements, because we will not belabor the point into the minister's celebration. Okay, so let me show this very quickly, because some of you have seen me put the VAERS information up here before. And so I went back and just looked at it today. I don't remember the date, but the last time I shared this information, there was a little over 92,000 complaints to the VAERS system. And here it is. I know it's not more than a couple of weeks later, and you see that number over there to the left. We're at 200,000 complaints about this vaccine. That's not something to look at. What happened to my, were you all able to see that?
Yes, sir.
Okay, so y'all see the number. It's not, if you want to know the specifics, just go to the VAERS site, look at the data of symptoms, and you can look at the data as far as the vaccines. So these people that were talking about the fact that Johnson & Johnson were having a lot of problems with blood clots. There are a lot of problems with blood clots with Pfizer and Moderna as well. And so I think it's important for you all to know, go look at, to put in context the reality of this vaccine. Within less than a month, it's gone from 92,000 complaints to over 200,000. And I am absolutely sure that those numbers are going to continue to go up. And the whole point of this show is not to act as if we are anti-vaccine. The whole point of this show is that wherever you stand, if you're against vaccines, if you're against this vaccine, if you are on the fence of what should I do, or you're on the defense of I am pro-vaccine, I don't care where you stand, you better do your research. And you should not do it based on propaganda. When people are pushing the vaccine, your question should be why? And then go and start looking for some quality information so that you can make a distinction. Lastly, my last point will be this. As my brother Abdullah said, I plan on holding those accountable in the Black Coalition Against COVID. These doctors, the Meharry president and the Howard president, the Morehouse president, the head of the Nurses Association, these Black people that came out and pushed this vaccine. They said that they wanted to be held accountable. We are going to hold you accountable. I have a list of all the doctors that I know personally that were pushing this vaccine. I am going to hold you accountable. I'm not trying to be mean. I'm not trying to make myself be more important than you, no. But you can't push this. And then when things start going south, you jump in the back and get quiet. No, come out and talk, just like my brother and sister have, with the bravery and courage, and admit that you made a mistake. And I'm not saying that it is, but it's looking that way. And if we get further into this and people are getting more and more sick from the vaccine, and these numbers continue to rise as far as deaths and adverse events, you should, as a person that promoted it, especially you Black physicians that promoted it on the Black community, trying to pose to Black community that you knew it was safe. You didn't have any information to say it was safe. You were talking the propaganda that you were being fed. And it's going to come a time where you're either going to have to stand on that, or you're going to have to turn around and tell the reality of what you see that's different than what you said in the beginning. And so, brother and sister, let's close out. We got 6 minutes for closing comments so we can get to the minister's beautiful concerto. So you all close out in comments, please. And I'll try to find this flyer.
Okay. Well, yes, sir. I'm happy you said that about the physicians. And yes, the people need to know that their hands are tied. The organizations that we work for, they're heavily pro-vaxxers. You can see that in all of the advertisement and all the money they've backed it with. Even our institutions, as far as our schools, are pro-vaxxers. So I'm not saying that it's right, but just to give a little mercy to all of our physicians. And even like you said, we have a lot to lose, a lot, you can get kicked out of school for saying the things that we're saying. You can definitely lose your lifestyle. I'm a contract worker. I'm a traveler, state to state. No one wants to hear, but I can tell you this, in the background, the public needs to know, I personally, going from state to state for the last 7 years as a travel nurse, I know a lot of physicians. I don't know one personally that has taken the vaccine, not one. Not one personally. They have always leave out of, and I can honestly say, like, most of your physicians' hands are tied. They go in the patient's room, and it's their job to advocate. It's their job to advocate for the vaccine. It's their job to be political about the vaccine. But you get them privately, you pull them behind the nurse's station and go, ask them that question. They say, no, I'm not getting that vaccine. And they are just as afraid as Dr. Abdullah has said. about the vaccine or scared or even hesitant for those who have taken it, but I personally don't know not one has taken it. I also want to say, let's look at the facts too. What we've learned in the past year, what we've learned is that if you get healthy, if you lose some weight, you get rid of that diabetes, you get rid of that hypertension, you eat well, you live a healthy living lifestyle, get rid of the drugs and alcohol, you will beat COVID. You will be able to survive COVID. That has been the history here. That has been the facts here. We don't know if you'll survive that vaccine. You just heard they're scratching their heads again about something that's bizarre and puzzling again. And we're putting vaccinated people in isolation. That is basically saying, from an infectious disease doctor will tell you, that means that person is possibly infectious. It means whatever they have going on, they can spread that to you. So,
floor is yours, my brother.
oh, I'm sorry. And I just want to say this. There is always a running joke among the nurses who work with COVID. We say we exercise 3 days a week, we eat healthy, and we walk into those patients' rooms and we think positive and we survive. Ask yourself how many nurses, how many doctors who are walking into these COVID patient rooms have survived and is surviving and did not get COVID. I did get COVID, but I also beat COVID.
Praise be to Allah.
Yes, praise be to Allah.
Thank you, my sister.
Yeah, I'll keep it short. I know we got to run. I'll just say, just continue to educate yourselves. Try to be safe. This isn't the time to relax. COVID is real. It is still killing people. I've lost people personally and family members and whatnot, as well as providers, doctors, nurses who have gone into the belly of the beast. And unfortunately, unlike most healthcare providers, I do see the worst side of this first. I'm seeing them as they come in, and though the numbers have gotten better and, we think we have a handle on it, there is nothing that's conclusive yet. So I would say that, again, make the decision based on what's in front of you. Talk to your providers, bring in your family, make a shared decision making where you're in control at all different times of what's going on. Because for you, like I said, the threat of death because of your lung condition or something, you may say take the vaccine. That's not out of reasonability, and I would understand it as long as you're informed. But we do just have to know that we don't know what tomorrow holds, and so it's for that reason that the only one thing that all of us should be able to agree on is that the words in these books behind all three of us here on this panel that we all have in our office, and How to Eat to Live, should be what we all aspire for. It doesn't hurt in this situation. We know it helps. And if we lead with that, then, we give ourselves the best chance. There's no guarantee you won't get it and you won't die from either the disease, the vaccine, or getting hit by a bus tomorrow. We just don't know those different things for us, but you got to take every precaution that you can. And so I thank you all for having me, and I'm more than happy to always, share, what we can, as long as we're not breaking patient confidentiality, because health literacy is a problem that's worst amongst Black people. So the healthcare system and the Black physicians and nurses should be the most out there trying to have these nuanced conversations, right? And the fact that we're not shows exactly what you're talking about. But I think that this is the time to have it. People, as long as you're leading with the facts, then there shouldn't be anything that you all should have to worry about, as long as you're not giving medical advice to people individually without knowing all of their details as well. So thank you for that. I salute all of you all, and I can't wait to hear the minister tonight.
That's right. So, brothers and sisters, you see up there on the screen the Ministers Ludwig van Beethoven Concerto, ministersmusic.com, ministers with an S, music.com. Go check that out. Let's wish the Honorable Minister Louis Farrakhan a happy birthday with our presence. I thank my brother and my sister. I love them. I respect them. I admire them. I appreciate them. I pray that you appreciate the information that you got today to put you on a more firm foundation with where we are and where we have to go. So I'm going to end it there. Thank you all for supporting the Ultimate Wellness Group. Next week, the Ultimate Wellness Group the Ultimate Wellness Group Transformation Testimonial Tuesday. There'll be people coming on next Tuesday talking about their testimony of improving their lifestyle through How to Eat to Live. Brothers and sisters, have a wonderful rest of your day. I pray that you go to this concert. And for the rest of you, I pray that you have a wonderful rest of your day, rest of your week. And we hope to see you here next week on the Ultimate Wellness Group Transformation Tuesday. Thank you. Peace.